Pediatric Urology last-minute flashcards. Newborn with prenatal ultrasound positive for hydronephrosis more than 10 millimeters AP diameter of the renal pelvis. What is the next best step? Renal ultrasound after 48 hours of life. A 1-year-old child presents with the first febrile UTI. What is the appropriate imaging study? Renal bladder ultrasound. Renal bladder ultrasound is recommended in children of any age after the first febrile UTI. A 4-year-old boy with weak urine stream, failure to thrive, recurrent UTIs, enuresis. The renal ultrasound is positive for bilateral hydronephrosis. What is the best test to establish the diagnosis? First, this is a case of posterior urethral valve. Why? Because it's a boy, occurs only in boys, weak urine stream, very important. And on ultrasound, bilateral hydronephrosis. By having these three keywords, this enough to suggest the diagnosis of posterior urethral valve. How to establish the diagnosis? By ordering VCUG. And on VCUG, you see here, the posterior urethra is dilated and elongated, which is abnormal. And you will see a filling defect here, radiolucent area with the head of the arrow. This is suggestive of the valve tissue or abnormal valve tissue causing the obstruction. So this is a case of posterior urethral valve causing bilateral hydronephrosis. A 10-year-old boy with a sudden onset of right flank colicky abdominal pain, nausea, vomiting, frequent urination. Physical examination is normal. The urine test is positive for 20 red blood cells. The renal ultrasound shows 3 millimeters stone in the right upper ureter. This is a case of nephrolithiasis or kidney stone. The best next step is pain medicine and aggressive hydration. Most stones smaller than 5 millimeters will pass spontaneously in children. First line recommended imaging study in cases of suspected nephrolithiasis is renal bladder ultrasound, not CT scan.
Having trouble or trying to pass the pediatric board exam? We have the definitive solution for you, presenting the Last Minute Review Series, a powerful tool for achieving success in pediatric board exams, crafted by Dr. Osama Naga, a board-certified pediatrician by American Board of Pediatrics and the editor of the Pediatric Board Study Guide, a last-minute review. Dr. Naga breaks down the most critical subjects in this series. The Pediatric Last Minute Review webpage offers a thorough and rigorous set of pediatric board review sessions that are in line with the study guide. The lectures will cover the most important topics for each condition that a pediatrician must know for pediatric board exams, as well as real-life clinical encounters. The inclusion of a clinical case scenario, accompanied by multiple choice questions, followed by the most probable answer and a comprehensive description of the issue, will ensure test readiness for each student. You will be able to download the lecture's PDF files to make your studies easier, to take notes and be accessible on the go and offline. Based on the membership plan you choose, you will have unlimited access to the lectures for either 1 month, 3 months, 6 months, or 1 year. By viewing these videos, you will increase your chances of passing the board exam and gain substantial advantages from the acquired knowledge. Additionally, by studying the material and completing the AAP prep questions from the previous 3 years, you will greatly increase your likelihood of passing the board and will acquire a wealth of knowledge. Click on the link provided below to visit lastminutepediatric.com and subscribe immediately. Be sure to take advantage of our free video samples on our YouTube channel, Pediatric Board Last Minute Review. Good luck with your exams.
This is the end. Thank you.